Good morning, everyone. We are just going to wait a moment while people are joining. Good morning, everyone. We're just going to wait another minute or two while people are joining the webinar. Okay, good morning. It looks like we are starting to slow down, so we will go ahead and get started. My name is Allison Barkoff, and it's my privilege to lead the Administration for Community Living here at the U.S. Department of Health and Human Services. And welcome to today's stakeholder call, where we will be discussing the recently released proposed rules regarding adult protective services, or APS. And we are very excited about this first ever federal regulation of APS. Let me start with a brief visual description. I am a middle-aged white woman with curly brown hair wearing a blue suit with a white blouse, and behind me is a white ACL logo on a blue background. And for accessibility, we have a sign language interpreter who's pinned, as well as CART. For anyone who needs that, you can open it at the bottom of your screen. Today, I'm joined by two of my colleagues, Edwin Walker, the Deputy Assistant Secretary for Aging here at ACL, and Stephanie Whittier Eliason, who leads the Elder Rights team here at ACL. Next slide. Just briefly for today's agenda, I'll start by giving you some background and a brief overview of the APS proposed rule. Stephanie will then walk you through some of the key focus areas and specific provisions in the proposed rule. And then Edwin will talk about resources for more information and how the public can comment. Next slide. For those of you who are not familiar, the Administration for Community Living, or ACL, is a federal agency that's part of the U.S. Department of Health and Human Services. And our mission is to maximize the independence, well-being, and health of older adults and people with disabilities, and to support their caregivers. We work to ensure that all people, regardless of age, disability, or level of support need, are able to fully participate in all aspects of community life, live with dignity, and make their own life choices. We fund a wide range of programs through a network of aging and disability organizations that are in every single state and almost every community. We also play an important role in HHS and across the federal government by advising the Secretary, other HHS agencies, and other departments on aging and disability policy. We also have a unique advocacy role that requires us to ensure that we advocate for the needs of older adults and people with disabilities, and that they're considered in all federal policies. And one recent role relevant to ACL's call today is ACL becoming what we call the federal home for adult protective services, something that has long been called for by policymakers and advocates, and that will be cemented by these new regulations. Next slide. So I'll turn now to give a little bit of background on the proposed rule. Next slide. When I joined ACL at the beginning of the Biden-Harris administration, we worked together to identify key priorities with our team, issuing the first ever federal regulations related to adult protective services bubbled up to the top. These regulations advance important priorities of our Secretary Becerra, as well as priorities of the Biden-Harris administration. One priority from day one for this administration has been a focus on equity and ensuring that all people have the benefit of federal programs. These proposed regulations advance that priority because they propose to establish uniformity in practice in APS systems to make sure that all people, regardless of where the person lives or who the person is, will receive quality APS services. The HHS Secretary and President have also recognized that health requires much more than just access to medical care. People's health is tied to what we call social determinants of health, things that include access to critical human services, long-term services and supports, housing, nutrition, and more. Adult protective services systems play an important role in connecting people experiencing or at risk of maltreatment with services that advance social determinants of health. This administration has also been focused on improving the quality of care and ensuring people's health and welfare regardless of where they live. These proposed APS regulations are intended to ensure that older adults and adults with disabilities can live healthy and safe lives in the community. And they complement other regulations that focus on the health and welfare of people in institutional settings, including nursing homes. Finally, this administration has been committed to expanding access to the home and community-based services that make community living possible. These proposed APS regulations are an important complement to that effort, ensuring that people receiving home and community-based services are healthy and safe and do not experience maltreatment, abuse, or neglect. Next slide. Stakeholder engagement is an important part of everything that we do at ACL, and stakeholders have played a key role in the development of this proposed rule. These proposed rules are based on the National Voluntary Consensus Guidelines for APS systems. Those guidelines were developed in 2016 with extensive input from APS systems and a wide range of stakeholders. And those guidelines were then updated in 2019. When we sought public comment while developing these guidelines, we received nearly 300 comments, representing the vast majority of states' APS systems and a wide variety of stakeholders from many different professional fields. Also, in 2021, we fielded the National APS Practice Survey to better understand the variations in APS practices, barriers, innovations, and model programs across states. We were so pleased that we had 100% participation by state APS systems. All of this work and all of your input helped inform the proposed rule that we are discussing today. Next slide. Before I turn it over to Stephanie to give you a more detailed walkthrough, I want to just give a high-level overview of the proposed APS rule. First, we decided in ACL that this was a critically important time for us to establish the first set of federal regulations related to adult protective services. State adult protective service systems receive federal funding for the first time as part of supplemental funding during the COVID pandemic. This funding was used by states to establish infrastructure and systems and address the huge increase in incidents of maltreatment, abuse, and neglect that we saw during the pandemic. The fiscal year 2023 omnibus that was passed in December 2022 had the first regular base funding for APS state grants. That has made establishing ACL as the federal home incredibly important. Second, the proposed rule recognizes that it is important for there to be minimum standards and expectations for state APS systems. Again, as I mentioned, people should be able to get quality APS systems, APS services, regardless of where they live. So this rule proposes to set a minimum federal floor, and of course, states can go above those minimum requirements. It will bring uniformity to APS systems nationwide, while at the same time respecting that there are unique needs in each state and locality. Finally, this proposed rule is intended to elevate the best practices that we are seeing from the field in state APS systems nationwide. I will now turn it over to Stephanie to walk you through the rule in more detail, and thank you again for joining us today. Stephanie?
Thank you, Allison. Okay. So the notice of proposed rulemaking in the Federal Register is broken out into 4 sections. We're going to walk through those sections very briefly so that you all know how best to approach reading the NPRM. They can often be very boring and confusing, but they're also very important. So we have 4 sections. We have the background, where we discuss adult protective services and adult maltreatment, and it sets the context in the preamble for what is the state of affairs currently in APS, where are those variances. Section 2 talks about the statutory and regulatory history behind the rule, and Section 3 is where you're going to find the most important substance, at least from a comment perspective. In Section 3, we discuss the rationale for each of the proposed sections of the regulation. And then Section 4 of the preamble discusses the required regulatory analysis, such as the burden, estimated burden on states, any paperwork reduction act requirements, et cetera. So we know that everyone is going to have an interest in some part of the NPRM preamble, but most importantly, I think for comment is Section 3 on adult protective services. So what is in the proposed rule? We have these sections that you see on the slide. We talk about eligibility for funding. We establish definitions, some program administration components, including investigations, conflict of interest, accepting reports, coordinating with other entities, some requirements around APS program performance and state plans. As you review the sections, the actual regulation in subpart D, it's helpful to go back and reference Section 3 in the preamble. It will describe why we propose the language that we do, and it also asks some specific questions for feedback related to each of the components that you see in subpart D. They work very complementary together, and it's very helpful to look at them together so that you can understand the motivation behind each of the proposed elements. So we're not going to walk through each and every section of the proposed rule. What we do want to do, though, is highlight some important concepts that you'll see as you read through the proposed regulation. Most importantly for us, it really incorporates person-centered principles and equity into APS. We know that this is an important feature of APS. It has been fleshed out in the guidelines as well as in the APS practice survey. We've heard from states. We know that this is a very crucial element. What we do with the regulation is we sort of codify that into the overarching concept of APS quality, practice, and service. As Allison mentioned, the regulations establish a set of mandatory minimum national standards with the interest of ensuring uniformity in practice. We also do address some of the conflicts of interest that occur with APS programs and have some policies suggested to help remove those conflicts of interest. We define key terminology, one, throughout the terms that we use throughout the rule, but in addition, key terminology in the practice of APS, such as minimum definitions of abuse, neglect, exploitation, and other concepts. We also establish a minimum number of categories of adult maltreatment that require response. And again, as Allison said, this is a minimum. States certainly can have more categories. They can define them to be more inclusive, but this is a minimum. These are minimum categories, excuse me. For the program administration components, essentially what those elements do is require the states to establish not only the policies and the protocols to coordinate with other entities and to respond to adult maltreatment, but we are also asking them to develop the mechanism, the how, not just the what, but the how they will do this coordination and improve their response. And then finally, we are requiring states for the first time to develop state plans for adult protective services, which we propose to be very similar to the operational plans that all of the states prepared when receiving the funding for the American Rescue Plan Act. And then finally, we are asking states to report annual data to ACL as a condition of receiving funding. For those of you who are familiar with adult protective services, we do have the National Adult Maltreatment Reporting System, which can be viewed as like a survey, a public health model of data collection about what's going on. But we are adding to that a requirement for states to report on their performance as a condition of receiving the funding. Okay, that is again a very high-level summary of what you'll find in the NPRM. And then Edwin is going to take over talking with you about how to comment.
Thank you, Stephanie, and thank you, Allison. What we've done is we've developed a set of resources to assist you in managing your comments with regard to the rule. And the first one really is a posting of where to find the rule if you haven't found it already. The complete proposed rule is in the Federal Register at this address. We also have added items to our ACL website where you can get to the rule through the ACL website, as well as other materials. And we have highlighted the rules provisions in what we refer to as a plain language fact sheet, which is also on our website. And so any of these resources are available to you to assist you in first finding the rule, being able to read through the rule, understand what we proposed in the proposed rule, and then to encourage your comments. Next, Stephanie. In terms of commenting, we really are encouraging everyone to comment. And this slide shows you how to do that. First, you see in the far left column that everyone who seeks to improve APS programs is encouraged to comment. We certainly want to have comments from Adult Protective Services programs, from all entities in the aging and disability networks, as well as people who may be served by APS programs. We believe by having a robust number of comments focused on the content and the best ways to operate APS programs, we can turn this proposed rule into a very solid final rule for operating and administering APS programs. In terms of how to comment, look at the second column, the middle column on this page, where you can comment online at www.regulations.gov, and the entire URL is there for you, or you can send in comments by mail to the Administration on Aging with this address directed to Stephanie Whittier Eliason, who you just heard from. And then third, it's important to highlight the dates by which you need to comment. The proposed rule was published and posted on September 12th. It's open for 60 days for comments to be sent in. And so it ends at midnight on November 13th, 2023. Next slide. This is where we want to open it up for any additional questions. I saw that there were some in the chats, and yes, we will make the PowerPoint presentation as well as a recording of today's webinar available on the ACL website. That way you can refer to it. You can get the links initially. You can get the links from us and go directly to the rule, the proposed rule. And I'm trying to scroll now to see if there are other comments we can or questions we can respond to. For substantive questions, I see that some people have made comments with regard to whether or not a particular item is included or not. We have outlined, and Stephanie has gone through the areas that we have addressed in the notice of proposed rulemaking. The rules don't provide us the ability to respond to specific comments. So if you have a specific comment or a specific area, please feel free to provide that as an official comment back to us with regard to this notice of proposed rulemaking so that we can consider it for purposes of developing a final rule. And let's see, are there any other comments that I could refer to? We again thank folks. We are aware that folks have already provided comments. We can check the Federal Register listing of folks who have provided comments to date. And we see that folks are very interested and very active. And so that's exciting for us. I'm looking through the comments now. I see a number of areas where I would encourage you to submit formal comments through the Federal Register process so that we can, including, I see a question about effective dates. One of the areas where we ask for comments on is what is a good effective date, given that we recognize that in some cases, states may need to change state laws or modifications to state policies and the like. That's an area we definitely want to receive comments on. Other questions as I'm scrolling through? Let's see.
Edwin, this is Allison. There was one question that relates to the intersection with Medicaid systems and Medicaid waivers, and that's another place where we are seeking comment on coordination across systems, including APS with Medicaid systems. So, and Marcia, if there is a way to put in the chat, and I think I did it, but to repeat again, all the places where we have a fact sheet describing right there. Thank you. So it is acl.gov/APS rule that has a fact sheet that highlights some of the key provisions, and you'll see some of the areas that you're talking about. On that web page, you can link directly to the Federal Register, and we will put these slides as well as a recording on.
Thank you, Marcia. Okay. Well, we are excited. I can tell you from a personal standpoint, this is something that we've been wanting to get done for some time. We've heard from advocates for decades about how important this is, and this is a huge step toward bringing about necessary uniformity and consistency and best practices across the country with regard to the operation and administration of APS systems. So
Edwin, if I could answer one question. Sure. So someone asked about how comments will be used by the reg making team. And just to be clear, so this is a proposed rule, and we are seeking your comment on what we got right, what we should think about changing, and areas we may have missed. And those comments will be analyzed by the team. And then as part of a final regulation, we will respond to those comments, and your input will impact what is in the final rule. So there is this proposed rule, and then your comments will help us get to, the comment period is open till mid-November. So most likely sometime in early 2024, we'll finish looking at the comments and put out a final rule. But that's why your input is really important. So just wanted to explain that.
Okay. Allison, would you like to close us out?
Sure. I will just close out by saying I am so pleased to see how many people jumped on this call. Well over 500. This clearly is a really important regulation. As Edwin said, we feel like it's a really, really critical time for us to set some basic standards and really start engaging and making sure that there are quality adult protective services available across the country. We really look forward to your input. Again, acl.gov/APS rule has a lot of resources for you. And of course, when we finalize the rule, we will again do a rollout and make sure that everybody knows where we land on the final rule. So thank you again. I really want to thank Edwin and Stephanie and the team across ACL that worked for many, many, many months on putting this incredibly thoughtful rule together. And I want to thank so many of you for joining us today, for the work that you have done in helping us get to this point in terms of your work with the consensus guidelines and your work with our surveys. And we really hope that you see some of your own fingerprints when you open the rule. So thank you very much, and we look forward to your input. And Marcia, we can close out the webinar now. Thank you.